Let's head to East Africa now, where Kenyan doctors stopped providing emergency services at public hospitals as they escalated a national strike that entered its second week. Thousands of doctors have stayed away from hospitals over poor pay and working conditions, despite a court order calling for talks between the doctors and the health ministry. Here's a report from Nairobi.
Dressed in operating room attire with lab coats, scrubs, face masks and hairnets, these medical practitioners in Kenya are an angry lot. Hundreds of them marched through Kenya's capital, Nairobi. Their nationwide strike for better pay and working conditions entered its second week. The Ministry of Health is urging them to return to work and hold talks.
Mine is to call upon Kenyans, do not shy away from accessing services, especially at our national referral hospitals, as we wait to resolve the standing issue with the doctors that are on strike. But as far as I'm concerned, the referral hospitals are working pretty well, and we are committed to ensuring that all facilities under the national hospitals are working.
The Kenya Medical Practitioners, Pharmacists and Dentists Union are demanding comprehensive medical cover for the doctors. Union leaders say 4,000 doctors are taking part in the strike. A Labour court order has asked them to put the strike on hold to allow talks with the government. But union leaders say they will disregard the court order the same way the government disregarded 3 court orders to increase basic pay for doctors and reinstate suspended doctors.
Because government has refused to honor the collective bargaining agreement that we signed 7 years ago. The government is on strike, we have just joined them. We are telling them we won't go back to work until the doctor interns are posted, until the doctor doing their masters, their school fees is paid and they are paid, until the medical cover for doctors is paid for, until doctors on contracts, poorly paid contracts, are paid on full salary on PNP. We won't go off until the doctors whose basic salary arrears was promised and awarded by the court 7 years ago and paid.
The impact of the strike is being felt across the country. Many patients are being left unattended or being turned away from hospitals across the East African nation.
I have been here since 8 o'clock this morning. We have been told to wait for doctors because they are not in. We have just been in the queue since morning. We have just been told to wait for the doctors, but they are not here. However, this is not the norm. By now, we would have been served if not for the strike. It's not usually like this.
The doctors also stopped providing emergency services at public hospitals as they escalated the strike. After meeting union officials and ministries, Kenya's head of the public service said the government could implement the collective bargaining agreement in phases due to financial constraints. Bureau Report, WION World is One.
For all the latest news, download the WION app and subscribe to our YouTube channel.